It says 15 testing stations will be popping up around the state of Tennessee to help. Here at home, the head of the health department says the county is working to figure out how pop-up testing facilities would work in our area. Dr. Martha Buchanan says there are a lot of factors they have to figure out first.
Having adequate supplies, being able to screen people who need to be tested versus people who just want to be tested. Again, if you're not symptomatic, you don't need to be tested for coronavirus or the flu or anything else. Only symptomatic people need to be tested, and symptoms, fever, cough, and sometimes shortness of breath. But fever and cough generally are going to get you tested for the flu maybe, or for COVID-19, depending on the rest of your story.
Dr. Buchanan says today that the department, hospitals, and private providers have been taking samples and sending them off for testing every day. Buchanan says if you have a fever of over 100.4 and you think you need to be tested for COVID-19, call the doctor's office or walk-in clinic, health department, or emergency room first before you leave. We're expecting to hear more from the county health department any moment now. We're going to take you to that news conference live just as soon as we do. As a matter of fact, Dr. Buchanan is just now beginning to talk. Let's listen in.
Knox County on the state website now has 2 cases of COVID-19, and we wanted to clarify that. We said we'd come to you and talk to you if we saw that we had community transmission. That is not this. I want to repeat, this is not a case of community transmission. The way the state and the federal government count diseases is based on address of record. The address of record for the person who tested positive is in Knox County. This person was tested in a different state and lives in a different country and has not been in Knox County during any period of their infectivity or during any period of their illness or before. So this was, again, a person who has their address of record in Knox County, lives in another country, got tested in a different state, and has not been in Knox County. So this does not pose any threat to anybody in Knox County. We wanted to clarify that because it is confusing. We're actually working to see if they will change that. We don't know if they will. So we're asking that the state look at that and work with probably the CDC to change that. But again, this person hasn't been here. They live in a different country, tested in a different state, and hasn't been here at all. So that's it. Any questions?
Yeah, just a question that Greenville is the only place that has a mobile testing site. Are we going to have those pretty soon? Do you know?
Well, we're working with all of our partners to see what's possible for us to be able to do here in Knox County. I'm not familiar with what they're doing in Greenville. That's interesting, and we'll make note of that and reach out to them and see how they've made that happen. As you can imagine, there are a lot of logistics and things that have to go into being able to do that. One of the challenges that we have is that the supplies to obtain the swabs, we've talked about, there's obtaining the swabs and transferring the swabs to the lab, and then the lab doing the test. So the supplies for obtaining the specimen and sending the specimen to the lab are limited and in limited availability. So that's one of our challenges right now. And it's not just for Knox County, it's a challenge across the country, across the state.
Do you know when that patient was last in Knox County that tested out of the state?
Yeah, I don't know. What I know is what's important for public health purposes is that that person has not been in Knox County during any time of their illness. They've been either out of the country or in another state.
Do they have family here that may have to be in isolation?
They haven't been here, so.
If this is happening across the country, is this something that could be throwing off numbers in other places as well?
I'm sorry, if what is happening?
That people are being counted in local totals but are not actually living there or have not been there. I mean, obviously you can speak to Knox County.
Right. And this is a guess, which is not good to do, but I don't think it's a very common occurrence. It happens rarely when we have even larger outbreaks. Occasionally somebody will be somewhere else and they get counted here because that's their address of record. It's not all that common, but it is just kind of how they count things. Again, we're working to get that changed so that this person will appear in the appropriate place, but we're not sure if we're able to do that.
Do you know which state they were tested in?
They were tested in a state that has ongoing community transmission.
You said it earlier today, and this is not a quote, but in essence, you said that you don't feel the total number of tests performed is a meaningful stat to release to the public. I'm not a doctor, I'm not an epidemiologist, I'm not an expert, but I'm just trying to understand that because I'm wondering how like, say if you have one confirmed case and you've tested 5 people, that seems a lot less meaningful than saying we've tested 100 people, we have one confirmed case. It's kind of like, how can you find something if you're not looking for it?
Well, the truth is we're looking for it, and not just us. Private providers are also testing. The capacity for private providers is only going up day by day, and so they're increasing access to testing in their facilities as they are capable of doing that. So right now, people can get tested in their private doctor's office or by the Department of Health, by us. But always call before you go, and they can advise you whether you need to come to the office or some other option. And always call us before you go. That's really important to remember. But private providers make a decision about testing based on the criteria that they have with their internal controls. So private doctors' offices, we don't dictate who they test. We don't tell them who they can or cannot test. We give them guidelines and recommend that they test people who have a fever and a cough. But they don't have to follow those guidelines. So we know that there are lots of people being tested out there that aren't at risk for COVID-19. We rely on our private providers to help us find cases that don't necessarily come through our system. So what's really important for us to know and for the community to know are the positive tests. Those are the people that we need to work with, isolate, protect our community, educate those around them, protect them as well as we can, and monitor them as indicated. And so that's the information we need. The system works really well. There's a big list of reportable diseases, and COVID-19 is one of them. We will receive those test results from the laboratory. The doctor doesn't even have to remember to let us know. The lab automatically reports to the state of Tennessee. The state of Tennessee then divvies it out to each of the counties where that person lives. And so that's how we find out lots of other reportable diseases, and it works really well.
Can you go a little bit more time for one more question, guys?
You are listening live to Dr. Martha Buchanan with some interesting developments in the second case of coronavirus that has been reported in Knox County. Here's what she said. This person was actually tested in another state, possibly lives in another country right now, has not been in Knox County, but their address of record was in Knox County. So she's trying to get the CDC to correct that, putting us back here in Knox County at 1 case of COVID-19 as of right now, according to Dr. Buchanan with the health department. She also said that private providers are testing right now to make sure if you feel you need to be tested, call ahead before you go to your doctor or the ER or the health department. The health department is testing as well. And a reminder, the Knox County Health Department has that COVID-19 public health line. You can call with any questions related to the coronavirus. That number, 865-215-5555. Also a toll-free number. You should jot these down, 1-888-288-6022. The information line is available from 8 a.m. to 4:30 p.m. Monday through Friday. But very quickly, this is so popular right now and so busy. Hundreds of people are calling. Hundreds of people, according to the state, have been put on hold. So they are operating a second line with about 50 people, a second number with about 50 phone lines available. That should be up and running, we're told, by the governor in about 48 hours, Bo.
Yeah, they were saying we get about 900 calls a day. That's why they had to add that second line.